Hi, I'm Tina Smillie. I am a retired pediatrician, and back after 10 or 12 years of doing general pediatrics, I started the first private practice devoted exclusively to breastfeeding medicine in the United States. And I did that for 25 years and retired about a year ago. So today, in this little snippet, we're going to talk about an easy way for babies to learn how to breastfeed. So as I described in a different little snippet, infants are hardwired for learning to breastfeed, and mothers are hardwired to calm them and respond to their infants. So an easy way to help babies learn to breastfeed is to harness those hardwired behaviors. Feeding behaviors are best seen when the baby is in the right place in the right time. And this means the baby needs to be in only mild hunger or thirst, so the baby is not too frantic for learning. The mother helps the baby by letting him feel snug and secure and comfortable. Then the baby's sensations help the baby stay calm while looking for the breast. The smell of the milk, the sound of the mom's voice start the infant on his search for the breast. Of course, in these earliest learning experiences, we need to catch the baby in mild hunger. What people used to call feeding cues are more than cues. They are actually feeding behaviors. That is, if the time is right, the baby is engaged, these behaviors can lead to successful feeding all by themselves. These early signs of very mild hunger are tiny little movements as the baby begins to wake, his eyes open, any little body movements, and then some mouthing movements and tongue movements. Then when the baby's quite ready to feed, we see the extremities flex, the hands go to the mouth, and the so-called rooting reflex, where the baby maybe turns to the face, it turns in the direction of something touching his cheek, or if he gets a stimulus on the chin, he opens up really wide. And then the infant will start turning and crawling and stepping towards the smell of the milk. But note that crying is a late feeding behavior, or not even a feeding behavior at all. It's a stress behavior. And the baby is crying. They may be too disorganized and too distressed to feed. So how can we harness the baby's instinct for feeding to make learning easier to both mother and baby? To illustrate, we have this series of videos. We want to start with a calm baby and notice that this is not even in a breastfeeding position. Mom's just talking to her baby, making eye contact, communicating, enjoying each other's company. We're not going to force the baby to breastfeed. That's actually counterproductive and provokes oral aversion. We just want the conditions that will allow the infant to follow his own instincts to do this. They're skin to skin, no pushing. The mom's waiting for this baby to make the first move. It's hard at first. Adults want to be in charge, and so it takes patience. We're on baby time. We have to just be patient while we wait for the baby. It's the baby, not the mother, who initiates the feed. And here we watch the baby moving down and getting onto the breast. As baby starts looking, this is not rote reflexive behavior. There's lots of ways the babies get to the breast, and you see one going down sideways, one going straight down, but they're all heading in the direction of the smell of the milk and responding to their position on the mother. Then the mother follows the baby's lead, and this one we would just watch for a little while as the baby gets a little bit hung up because lactation consultant decided to help, and it all actually slowed the baby down. And now the baby recovers and is getting onto the breast. And there we go. So, and then as the baby moves, it's the feel of the baby's chin on the breast that makes the baby reach up and open really wide. And it's the feel of the nipple on the palate that keeps the baby suckling. So the key to good attachment for good milk flow, both mother and infant comfort. And when they're both comfortable, relaxed, and there's no infant tension and the mother doesn't have any pain, we can have effective feeding. When we're talking about comfort, we're not just talking about the mouth and the nipple. We want to look to the mom's and the baby's whole bodies and make sure that their whole bodies are comfortable and they fit together comfortable. Neither one is contorted into an odd position. We want to look at their total body comfort and how they comfortably fit together, almost like two pieces of a puzzle. So instead of thinking of discomfort or pain as a bad thing, that not only are you in pain, but you're also doing it wrong, instead we want to think of discomfort or pain as a guide to help find a more comfortable, more effective position. Because pain can indicate poor milk flow because the baby is pinching the nipples shut, and the mother's too uncomfortable to get a let down. So pain is a sign that the mother needs to shift around to get more comfortable. So it doesn't matter if the mouth or the position looks okay to you, to the outsider. If it hurts the mother, it suggests interference with flow, either from that pinchy latch or from interference with oxytocin and milk letdown. So pain is a signal. It says do something, adjust something around to get comfortable. And if she can't get comfortable because she's already got injured nipples, she may need to take some time off to let those nipples heal. So again, the mother doesn't need to overthink this. She just intuitively moves this way or that to get herself comfortable, just as I might shift around to get myself comfortable in a chair. So the bottom line is that comfort guides the whole process, from calming the baby to start the search in the first place, to the mother's adjustments to get comfortable, to become comfortable and to assure good milk flow. And it's the comfortable flow of milk that rewards the baby and makes the instinctive process move from an instinctive process to a learned behavior. So a quick review is that we start with a calm baby, and it's the baby, not the mother, who initiates the feed, and then the mother, following her own instincts, responds to her baby as she then also seeks her own comfort, and that helps assure better milk flow for her infant. So it's instincts, both the baby's instincts and the mother's instincts, those hardwired neurobehaviors that start the process of learning. And then it's the successful transfer of milk that gives the baby the feedback, the reward that teaches the baby that those moves worked, gives them the motor memory. So with repeated success, we move from an instinctive process to a learned behavior.